Hello, this is Dr. Shahram, and I would like to explain to you a little bit about the complex anatomy of the nose. And I believe that if my patients understand the basic anatomy of the nose, it will help them in their operation and also in their recovery. So as you see, the nose from outside has some parts. And if you know these parts, then we can have a better conversation. The top part of the nose is called the radix. Then we have the hump. Then we have the supratip area. We have the tip, and then we have the columella. And these are obviously the nostrils, and this is called the ala. The other important thing is the proportions of the nose. So the angle that you will have here, if it's raised or if it's brought down, we call it rotation and derotation. So rotation, when we say, is about the angle of the tip of the nose. The other thing is the length of the nose. So this is the length of the nose, and this is the projection of the nose. Now, if you remove the skin, unlike what you would think, there is a very complex anatomy. We have a bony part and we have a cartilaginous part. This part is flexible and this part is naturally bone, so it's hard. The way the cartilage is attached to the bone is called the keystone area, and it's very complex. Every single human being has its own specific connection, like the iris of the eye. These ones are the lower, let's say, cartilages, which they shape the columella and also they shape the tip. The proportion between the tip and the upper cartilages makes the supratip, that in some people they would like to have a little bit of a curvature there. This part, as I told you, is the radix, and by lowering the radix we can slightly shorten, or by raising the radix we can slightly increase the length of the nose. Now if you turn the nose over, what we do from inside, you'll see that there is a wall in between the two sides of the nose, and this is called the septum. And when you hear that there is a septal deviation, means that this septum is curved, and sometimes it obstructs the airways, and sometimes if it's further up, obstructs the sense of smell. So correcting a nose is basically correcting the septum and the outer structure of the nose together, because they form one unit. Very rare cases you can correct the septum without interfering with the shape of the nose, but that is very rare. Usually they go all together. I hope that this video helps you a little bit to ease you in communication about your desires of your rhinoplasty, and also will help you understand that it's a complex structure